Okay, hey guys. We're gonna do chapter 6 this evening. So this chapter can be a little bit intimidating. One, I'm gonna tell you, read your chapter, highlight, take notes, however you do it. This stuff is important. Um, we're gonna go through the slides. I'm gonna hit and miss on some stuff. We're gonna try to move along. Um, there's a couple things in here that I will throw some hints and tricks out for. Just try to help you remember it better. I've got my little laser pointer going, so I'll try to point things out. So anyway, if I can get my computer to work, we'll be ready to roll. Here we go. Okay, so the anatomy and physiology. We're going to use simple anatomy and physiology. We're going to look at the upper airway. We're going to talk a little bit about the lower airway. Heart, vessels, lungs, blood, skin. I think I said muscles, bones, and just get a basic fundamental idea of what we're doing. A lot of this you guys already know, it's common sense part of it. We're going to talk about lifespan development, and this is just age related differences for different age patients, all the way from neonate up to your elderly. Once again, not in deep detail. That's later on in other chapters. You must understand the basic structure and fundamentals of the human body. So what it's going to do is going to give you a better understanding of specific locations, and so the symptoms patients are experiencing. It's going to give you an idea of what might be going on. Adequate patient examination, which when we start doing our skills and we learn how to do a patient assessment, you'll learn that. Communicating, which we've already discussed, and providing appropriate emergency treatment. So if we have an idea what's going on and we know what lies within the body, then we can treat it a lot faster and safer. So topographic anatomy. This has always been tough for me. Um, I'm going to tell you, just practice this, take notes, take a picture of this with your cell phone if you want. So anterior is the front of the body. Okay, front side. Actually, I'll back up. You need to know what the anatomical position is. You're going to hear that phrase. So facing you, see if I don't know if it'll pick me up or not if I stand up, but if I'm facing you and my palms are going to be out, my arms down to my side. So my palms are straight out and I'm facing you. That's the anatomical position. Okay. Um, that picture that I just showed you a second ago, that's the anatomical position right there. You're going to hear that word a lot. From here on out, that's exactly, we describe every patient if they're in the anatomical position when we describe the location of injury or location of pain. So anterior is the front side of the body, front surface. Posterior is the back. Midline refers to an imaginary vertical line from the head to the toes, and it separates the body left to right. So it's an imaginary line that splits you right down the middle, separates left and right. Midline is left and right. Some standard stuff. You guys need to know this. It's going to be on quiz. It's going to be on test. From here on out, we're going to use these terms. Medial is closer to the midline, so it's closer to the center. Lateral is going to be away from the midline. Proximal is close. Distal is distance. Superior is closer to the head. It's superior, so it's higher. And then inferior is closer to the feet. Okay, it's down, inferior. Super simple. Okay, those 3 slides are super important. If you need to back up, go ahead, get them down. Say them at home, point at people at Walmart, and describe locations of their tattoos, whatever it takes. So the respiratory system consists of structure of the body that contribute to normal breathing. There's a respiratory chapter coming up that we're gonna go into detail, so I don't want to spend a lot of time on this. I will tell you, I love the respiratory system. It's so cool. Brings oxygen into the body and removes waste or gas, carbon dioxide out of the body. Once again, you got to know these. So you got your upper airway, your trachea. You come down and you got your carina, which is where that bronchi splits, and goes to your left and right lungs. Your bronchioles are in your lungs. Your main bronchus are the two splits. That's your main bronchus. Your bronchioles come off of that, and then it goes down even further, which we'll talk about in respiratory chapters. Your lung, your diaphragm, or ribs. So your diaphragm is what actually causes air come in and out, which we'll talk about. So your airway consists of your nose or your nasopharynx. Okay, you remember medical terminology. Chapter or two ago, we talked about naso and oro. So naso is your nose, your mouth, or your oropharynx. Then you've got your throat, you've got your larynx, which is your voice box. Okay, your trachea is your windpipe, and then passages within the lungs. Once again, here's everything we just discussed. You've got your nasal cavity, your nose, your mouth, your oropharynx, right there, nasal pharynx, oropharynx, pharynx, epiglottis. It's a little leafy shaped thing. And if you'll remember that it's leaf shape, quizzes and tests are going to ask what the leaf shape object is. It's your epiglottis. Your larynx or voice box, your esophagus, your trachea or windpipe, and then we get to the lung. Everything we just talked about just gets repeated. So oxygen and carbon dioxide are exchanged in the alveoli and tissue. So this is where the lungs get really cool for me. So at the base of your lung, it comes off all them little bronchioles and stuff, and it comes down, and there's alveoli. I don't remember the exact number. I want to say it's 400 or 4,200 million alveoli between your two, something like that. We don't use all of our alveoli at once. So they're little balloons, and they blow up. They have oxygen in them. That oxygen goes into our capillaries, while carbon dioxide comes out of our capillaries. And when we breathe out, it pushes the carbon dioxide out of our body. If you will watch my video on YouTube, there is one that's called redneck breathing, I think is what it's called. The way I explain this is it's a bus station. Oxygen is going to work, if you will, in the body. It's getting off the bus, which is our breathing pattern. Carbon dioxide is leaving work. It's been in our body, and it's getting on the bus and getting out of town. That's just how I remember it. Watch my video. I think it's like a 10-minute video, and it breaks down the respiratory system in a way. The act of breathing, it kind of explains it simply. So, like I just said, we breathe in, it goes through all what we just talked about, that upper and lower airway. It hits our lungs, it goes through our lungs, it gets to our alveoli. The alveoli, like I said, filled with oxygen. The oxygen diffuses, okay, into these capillary beds, which surround the alveoli, and gets pushed out to feed our tissues, our cells, all of that. At the same time, carbon dioxide is getting offloaded, going back up through the lungs and out when we exhale. Real quick, a little bit here. Air is inhaled when the diaphragm and chest muscles contract. Air is exhaled when the muscles relax. So your diaphragm, and don't read your chapter because this is just how I understand it. So when our diaphragm drops, it helps air come in. Okay, it's creating a pressure that helps pull air in. When we breathe out, our diaphragm lifts and air comes out. Now that's not 100% correct. If you understand the process is what's important here. So we want that diaphragm to go down, air comes in, diaphragm goes up, air goes out. It's just a simple way to remember it until we get more advanced. When we get more advanced, advanced EMT, paramedic, then we can get into a lot more detail. That's just an easy way to understand the respiratory system or process. So the circulation system includes heart, blood, and blood vessels. We're going to talk a lot about this, especially when we get to the shock chapter. When we start talking shock, I'm going to really hound you guys on the process of the heart, the blood, and the vessels. So anyway, so here we got a picture. You've got your lungs. On the other side, you've got your heart. It's everybody says it's on the left. It is actually kind of more centered. It's left of center, but it's more center than people in their minds think, I guess. Your aorta, your inferior vena cava. So these, your aorta and your inferior, they're actually in your heart. This is just showing them where they're at, further down in the body. The flow of blood. So blood picks up oxygen in the lungs. It goes back to the heart. From there, it goes up and out into the body. The heart pumps it to the rest of the body. Cells absorb the oxygen and nutrients from the blood, and they release waste products. Blood carries the waste back to the lungs, carbon dioxide, and kidneys, where it is filtered out, and the blood is cleaned so that we can continue the cycle. In the lungs, blood exchange carbon dioxide for more oxygen, which is what we're talking about. That takes place at the alveoli, right? The heart consists of 4 chambers. So your upper chambers are called your atriums. Your lower chambers are called your ventricles. Chambers work together to pump blood to the lungs and to the rest of the body. I've got a really cool video on YouTube. It's not mine. It's one I found. Type in 3D. Man, what is that? I think it's 3D. Like blood flow or something, and it shows this awesome view of how the heart works and moves blood around. I will try to find it and add it to one of my videos. One way to check, oh, sorry. Let's see. One-way check valves allow blood to flow in one direction. So if you don't know what a one-way check valve is, it opens one way, and when it closes, it locks. So blood can go in one way, but if it tries to come back, it's blocked. It won't come back through. That's a one-way valve for anybody who doesn't know. So blood's gonna come in your atrium, your ventricles, goes up here through the pulmonary arteries, it comes around and comes back in. Ventricle, atrium, up, out to the rest of the body. So this is your aorta. Pulmonary artery. What is pulmonary? Lungs. So this is going to your lungs. Pulmonary veins. That's where it comes. So I should type. So blood's coming in here, comes down through your atrium, ventricle. It goes up through the pulmonary artery to your lungs, picks up oxygen, comes back up to your pulmonary veins, into your atrium, down to your ventricle, comes up through here to your aorta and out to the body. Okay. You don't have to know this perfect right now, EMR. What you do need to know is atrium is on top, ventricles are on the bottom. Arteries go away from the heart, so it's oxygenated. Artery starts with A, away starts with A. That simple. Arteries go away from the heart, so it's oxygenated. Veins or venules go back to the heart with what I call dirty blood. It's carbon monoxide. Until it gets to the lungs, it's dirty blood. Let's see, we're going to call the superior vena cava blood from the body. So it's coming in from the superior vena cava. Like I said, get on some YouTube channels. You can watch the flow of blood. If you do that, I promise, take 2 minutes out of your day, you will understand the basic workings of the heart better than you do right now. 2 minutes out of your day, watch 1 or 2 videos on YouTube. Makes a huge difference. Arteries carry blood away from the heart, which we talked about, at high pressure, and therefore leave thick walls. Have thick walls. There are 3 major arteries. So we have our carotid, which is up here in our neck. That's where we can check pulses. Go right under that jawbone, and you kind of push in there pretty good. Feel around, find your carotid artery. You've got one in the groin. That's your femoral. You can dig around down there if you want. I'm not going to demonstrate that. And then you've got your radial, which is the most famous one. It's in your wrist. So get in there. You can find that little notch. There you go. And you can feel your pulse. When we're checking pulses, which we're going to talk about this later. If they're awake and alert, we can check them in the radial. If they are unresponsive, we want to go carotid. But that's a whole nother chapter. Circulatory system. Carotid, right there we talk about. Okay, either side of your throat. You get up in that little notch between your jawbone and your throat, and you can find them. Femoral, okay, that's down there in your groin, and your radial is in your wrist. There are other pulse points, but we're not getting into that today. Capillaries are small vessels. Veins are thin-walled vessels that carry blood back to the heart, the dirty blood. Blood has several components. So blood has plasma, it has red blood cells, it has white blood cells, and it has platelets. Read your chapter, take some notes, look up definitions. I think I said this in the beginning of the class, the more you put into this class, the better you're going to be. If you want to be good at the job, which you should be, that's why we do this, to help people. Put in the time and look stuff up. Skeletal system. Skeletal system consists of bones and connective tissue that protect and support framework of the body. It has 3 major functions. This is going to be on a test. What's the major functions of the body or of the skeletal system? It's to support the body. Okay, it's our framework. It protects vital structures. Makes sense. Like our rib cage, it protects vital structures. And then it manufactures red blood cells. 3 things. So a very broke down, easy skeleton here. Guys, the skeleton scared me to death when I started school because that's a whole lot to learn. It's not that bad. So we've got the skull. We all know what that is. Our clavicles and our scapula, which is part of the shoulder girdle. Okay. We have our sternum, which everybody knows what that is. Thoracic ribs. We have our vertebrae column. We have our pelvis. Come down here, lower extremities. Up here, arms, upper extremities. We break that down a little further. We have our humerus. So it's not funny when we hit our funny bone, which is connected to our humerus. It's not humerus, right? When we get hurt. And then we have our ulna and our radius. So ulna is on the opposite side of our thumb. We take our radial pulse next to our radius bone. Okay. Ulna, radius. Our thigh bone, one of the biggest bones in our body, is the femur. Okay, right here, that's our femur. The kneecap is called the patella. They're going to use these names. Okay, patella, just get used to it. You're going to get questioned on it. Tibia and fibia. So your tibia is your bigger inside bone. Your fibia is the smaller bone. We tell little fibs. Okay. Fibia is the little fib. The skull. Okay. It's the bone of the head. Bones of the head include the skull and the lower jawbone. The skull consists of many bones fused together to form a hollow sphere that contains and protects our brain. So if you'll remember, when you're dealing with an infant, they say, oh, be careful of the head, be careful of the head, don't hit the soft spot. And that's because that skull has not fused together. They're still forming together. So it's made up of multiple bones. It's not just one solid one. So the jawbone is a movable bone that attaches to the skull and completes the structure of the head. That's the final piece, is what they're saying. There are medical terms for these, but we're going to talk about them later in a different chapter. You've got the spine. It consists of 33 vertebrae. Spine vertebrae are stacked on top of one another and are held together by muscles, tendons, disc, and ligaments. The spine, it's got the spinal cord the spinal cord passes through the hole in the center of each spinal vertebrae. Spine has 5 sections. We've got the cervical spine, which is our neck. We've got our thoracic spine, which is our upper back. We have our lower spine, lumbar spine, which is our lower back. Our sacrum, down there towards the very bottom. And then we have our coccyx, which is our tailbone. We've all bumped our tailbone. It's not fun. The way my instructors taught me was it's breakfast, lunch, and dinner, and then 5 and 4. So we've got cervical is 7, breakfast, right? 7 o'clock. Thoracic is lunchtime, it's 12. Lumbar is supper time, it's 5. And then if you want to be like me, it's 5 o'clock is also snack time because I eat sweets right after I have supper. And then 4 can be 4 hours later is when I have my good night drink. So 7, 12, 5, 5, 4, make up your own way to remember if you want. Will be test questions. How many vertebrae are in the thoracic vertebrae? It'll be something like that. The shoulder girdle, you heard me say that earlier. So each one supports the arm and consists of 3 bones. So we've got our clavicle, which is our collarbone. We've got our scapula, which is our shoulder blade, and our humerus, which is our upper arm bone. So clavicle, right here, okay, my collarbone. My scapula is that big triangle-shaped bone in the back. And then, of course, my humerus. This bone right here, my humerus. And that is upper extremities. They consist of 3 bones. Your upper extremities are your humerus, we talked about. It's your ulna and radius. Remember, radius is the same side we take our radial pulse on. So radius is on the inside. And then your wrist and hand consist of several bones. It talks about your rib cage. There's 12 sets of ribs that protect the heart, lung, liver, and spleen. Remember what the ribs protect. So we've got our 12 rib bones, right? This down here in 12 is called your floating rib because it doesn't attach with cartilage. Your sternum is located at the front of your chest, so your sternum. And then you've got your xiphoid process. I'm going to move my camera a little here, which is if you'll go down your sternum, down, there's a notch where it stops. That is your xiphoid process. The pelvis serves as a link between body and lower extremity. So your upper body and your lower body. It protects the reproductive organs and other organs located in the lower abdomen cavity, or abdominal cavity, sorry. Lower extremities, each lower extremity consists of thigh and leg. I kind of thought there'd be a picture, but your thigh bone is your femur. It is the longest and strongest bone in the entire body. Leg has two bones called the tibia and the fibia. The tibia is the bigger one. The fibia is the little fib, right? It's the little fib we tell. The kneecap is the patella. It protects that knee joint. And then ankle and foot contains a large number of smaller bones. Joints, where two bones come in contact with each other, a joint is formed. Held together by supporting tissue called tendons and ligaments, lubricated by a thin fluid that is contained in a sac surrounding the joint. So there's different types of joints. There's fused joints where they two come together and they're fused together. They don't move. And then you have your hinge joint and your ball socket joint. So your ball socket is going to be something like my shoulder. It can go up and down, forwards, backwards. Okay, that is a ball socket. The ball sets in a socket and is allowed to move multiple directions. You then have a hinge joint. Your knee should be a hinge joint. They set in there and they're not supposed to go this way, but they are allowed to do this. It works as a hinge, just like on a door. Okay. If it's doing the other one, we're in trouble. Skeletal muscles provide support and movement. Sorry, we're at the muscular skeletal muscles. Alternately contract and relax. So muscles can contract, as we know, we can flex, we're contracting it, or we can relax. Smooth muscles carry out automatic functions, also called involuntary muscles. And then we have the cardiac muscle, which the only place you're going to find cardiac muscle is in the heart, right? The heart is the cardiac muscle. Nervous system governs the body's functioning. It consists of the brain, the spinal cord, and individual nerves that extend throughout the body. I think most of us understand how this works. So sensory and motor area of the brain, the sensory nerve endings in our extremities and throughout our body, the spinal cord, the peripheral nerve, motor nerves, motor in the form. So I'm not going to read all these. So we all understand that our brain tells our body something, or our body tells our brain something, and it happens, right? There are thousands and millions of nerve endings throughout our body. The way you feel, the way you touch, all of that is caused by nerves. So if I touch something, okay, my computer, I touch it, I felt that touch because nerves sent a signal to my brain through my spinal cord and told my brain I was touching something. That's what all of that's talking about, okay? Throughout your spinal cord, They're just nerves shooting out everywhere. I'm sure you guys have seen pictures of it. It's really cool, really crazy at the same time. The brain is the body's central computer and controls the following functions. So thinking, voluntary actions, involuntary actions. We shouldn't have to think to breathe if we're healthy. That's the best one I can use as an involuntary function. It happens by itself. I blink. I don't try. Voluntary actions is when I have to think about something to do it. I want to reach out and grab my microphone and knock my phone over. I want to reach out and grab my cup. I'm thinking about it and I'm making it happen. That is a voluntary action. So the spinal cord is a long tube-like structure that extends from the base of the brain, which you're going to learn about in another chapter. I'm not going to go through all that. The digestive system breaks down food into the form that we can be carried by the circulatory system to cells of the body. Food that is not used to eliminate or to, food that is not used to feed our bodies is eliminated as a solid waste. Major organs and digestive systems are located in your abdomen. The digestive tract begins at the mouth and continues through these other structures. So we put stuff in our mouth that goes through our throat, esophagus, stomach, small intestines, large intestines, our rectum, and then our anus. So we all know how we eat, right? We know that if we eat, eventually we're going to go to the bathroom. That is the process right there. The digestive system also includes three other organs: our liver, our gallbladder, and our pancreas. We're going to go into all these later. I'm not going to beat a dead horse by trying to explain it right now. Responsibility of the body's reproductive functions and the removal of waste. Major male reproductive organs are the testes, which produce sperm, and the penis, which delivers the sperm. Major female reproductive organs are the ovaries, which produce eggs. The uterus holds the fertilized eggs during pregnancy. And then eggs are released by the ovaries. They travel to the uterus through the fallopian tubes. External opening of a female's reproductive system is called the birth canal or the vagina. So removal of waste product begins in the kidneys, which filters blood from the urine. The urine flows down from the kidneys through tubes into our bladder. Our bladder fills up. We feel the need to urinate. The bladder collects and stores that urine until it hits a certain point and we feel the urge. And then it passes out of the body through our urethra. The skin, it covers the body. It is our first line of defense. It has three major functions: protect the body against harmful substances in the environment, regulate body temperature, and then transmit information from outside environment to the brain. So like when I touched that earlier, my skin touched it and then it went through, my nerves realized what was happening, and so forth. So your skin, you have your dermis, is the deeper, the inner layer of skin. And then you have your epidermis, which is the outer layer of skin, which is located on the top of the dermis. I don't know why they put that in here backwards. So let's just start here. So our epidermis, okay, it's that top layer right there. We have our dermis, which is the deeper layer. And then our subcutaneous, which is that bottom layer. We've got veins, we have arteries, hair follicles, go pretty deep. Tissues, sweat glands. I'm pointing out right here that right there is one of those nerves I was talking about. Okay. We have the hair shaft, so you can see that hair actually goes quite a way down there. So when you pull hair, that's why it hurts. And then our, which is what allows us to sweat and control temperature. Skin is an effective barrier to bacteria and viruses as long as it is not broken by injury. Skin can perceive or sense to touch, pressure, pain, degree to hot and cold. Just what I talked about earlier when we was talking about nerves, it starts at the skin. When we cut our skin, our protection's gone. It goes to the nerve. That's why we feel pain. When we touch something hot, our skin reacts. It sends a signal. The nerves get that signal. They send it to our brain. It's all connected. Stages of life, growth and development. So throughout a person's life, body changes consistently. In an infant's airway is very small and is easy to obstruct by swelling or objects. Because toddlers have poor coordination and balance, they are at a higher risk of falls. School-age children are physically active and prone to injuries from bicycle riding and other athletic mishaps. Kids are going to be kids, right? We can talk about this later. There's a whole chapter on it. Let's see. Adolescents do not fully understand consequences of dangerous actions. Your early adult is the period when most body systems are fully developed. Middle adult is generally the time when the body systems start to decline. That's where I am right now. During late adulthood, the decline becomes more pronounced. Thought I heard my door open. We're going to there's a chapter in here, and we're going to talk in detail on each one of these age groups. And they're extremely important because each age group will act and react differently to each situation, whether it's medical, trauma, whatever. So we will get into these later. Most common, vital signs. This is a big one. If you remember 2-3 chapters ago, I preached a lot about vitals. Most common measured vital signs are pulse rate, respiratory rate, and blood pressure. There's more to it than that. Right now, that's what we're going to talk about. So a pulse, I want to know the pulse rate. I want to know if it's strong. I want to know if it's weak. The respiratory rate, I want to know if it's normal breathing, if it's fast. Are they working to breathe? Do I hear anything when they breathe? Blood pressure, we're going to teach you one-on-one in class. If you're just watching videos and trying to get an idea if you want to be an EMS, blood pressure is not that difficult. Watch some videos on it, send me a message, and I will do a video on blood pressure if I need to. So normal vital signs change with age. Normal pulse and respiratory rates decrease, and systolic blood pressure will increase. Like I said, I need to do a video on nothing but vitals. They are that important. This is very important. Right now, pause this video, take a picture with your phone. You can also order, and I don't have them in here. It's like $14 on Amazon, and you can get a stack of like 20 cards to carry on you or keep while you're going to school. Keep them in your backpack. You can see all these until you learn them. So infants, your pulse rates, respiratory rates, your blood pressure, systolic blood pressure. I'm sorry. Children, age, and adults. These are super important. This can be a telltale sign that something is going south really fast. Like I said, go ahead and learn these. Let's see. Facts that can change certain vital signs. Variation in normal vital signs values depend on the following 3 factors: a person's size, a person's degree of physical condition, and medication that person takes. So age, I'm going to throw that in there, size, their condition. I'm going to use myself as an example. I'm almost 42 years old. I'm in decent health, but I will tell you right now that if you took my blood pressure, it's going to be horrible. You take someone who is identical weight and size as me, if they eat healthy and they exercise more than I do, they might have really good blood pressure. So it varies. You have to know the dynamics. So things that can increase pulse rates, respiratory and systolic blood pressure is exercise, fever, illness, pain, stress, excess body weight, abuse of illegal drugs, things that can decrease it, athletic condition, blood pressure medications, abuse of illegal drugs. I'm gonna throw alcohol in there too. It can definitely play a role. So the reason athletic condition, I just want to touch on that real quick because they are physically in good shape, so everything is working better. So they're able to maintain longer than other people can, if that makes sense. That's why I was saying someone identical to me who actually works out and is healthy, um, and doesn't eat the 1 pound bag of peanut M&Ms like me, they are going to have better blood pressure. They are going to have a more steady pulse rate. They're not going to breathe hard when they work out for 5 minutes. So there's a lot of dynamics that go into this. That's why that very first set of vitals we get and that history taking that we're going to learn how to do is extremely important. So the summary, guys, the respiratory system consists of lung and airways. We're going to talk about all this later, like I said. Circulatory system is your heart, which is your pump, your blood vessels, which are your pipes, and your blood, which is your fluid. When we start into the shock chapter, I'm going to really hound you guys on this one and teach you everything you need to know about that. Skeletal system consists of bones of the body, and what's its main job? It is our framework, right? Your muscular system consists of 3 kinds of muscles: your voluntary skeletal muscles, your smooth, which is your involuntary muscles, and your cardiac muscle, which is your heart and only your heart. Nervous system consists of your brain, spinal cord, and individual nerves. Your digestive system consists of your mouth, esophagus, stomach, intestines, liver, gallbladder, and pancreas. Endothelial system consists of organs and reproduction, together with organs involved in production and excretion of urine. And let's see, skin protects the body from the environment, regulates internal temperature of the body, and transmits sensations of skin and nervous system. Vital signs change at different points of the life cycle. Guys, this is just the entry level. I threw a whole ton at you. Read the chapter, highlight, take notes. But I promise you, each one of these is going to get broke down later in the book, and we're going to go into a lot deeper detail. So just stick it out. You guys are doing great. You're on chapter 6. You're just now getting into the fun part. Thank you for sticking it out with me. I hope I'm helping. If you need more, send me a message. I can't stress that enough. If there is a certain section or chapter that you just aren't getting or you're not comfortable with, please let me know. This is what I like to do on my day off, is help other people learn it. So please let me help you. All right, guys, that is it. I will catch you on the next one. Sorry, my computer's screwing up on me. Next chapter is chapter 7. I don't even know what chapter 7 is. Chapter 7 is airway. It's my favorite one. So buckle up, Buttercup. We're going to go at it.